Pfizer one step closer to applying for emergency approval of its COVID vaccine, but those who suffer the most COVID-related deaths and infection rates are the most skeptical. A recent survey shows that only 32% of Black adults say they would get a vaccine, despite the fact that they are twice as likely to die from COVID-19 and nearly 5 times as likely to be hospitalized with it. Newark's very own Dr. Sampson Davis, an ER doctor, joins us this morning to discuss why there is so much mistrust in the Black community over COVID-19. Dr. Davis, thank you for joining us today.
Absolutely, and thanks for having me. And I think you bring up a very important question and point about the distrust of African American communities when it comes to the medical system. And this is from historical factors. You could go back as far as 1932 and look at the Tuskegee experiment, where Black sharecroppers were intentionally infected with syphilis to see what type of impact the disease will have on the body. And penicillin, which is the cure, was readily available. So this has sort of been passed down from generations to generations. And today's generation, although we're not alive during that time, most of us still have the ramifications from such an experiment that took place.
Doctor, let me ask you, even more so in modern times, right? When we're talking about the first surgence of the coronavirus in Black and brown communities, there was not enough testing. There were not enough hospital beds, ventilators, whatnot, so people were dying. And so there is this sense that, oh, now you have a vaccine and you want to flood our area with it and you want us to be the first to take it and experiment with it. There is that long-standing mistrust that is still there. And do you feel that it's valid?
Yeah, I mean, I you know what? Actually, I feel like it is valid. I think the medical community and for the greater part of majority of America have to do a lot to sort of earn back the trust of African Americans in our country, just because of just the historical factors. But when you look at the virus itself, it has impacted Black and brown communities the most, just simply because of just the exposure, the close quarters of living, the fact that most of us are on the front lines or working day jobs that we have to still go to work and don't have the luxury of working from home. And now you see this vaccine, which, you know, all of us would say it takes 5 to 10 years to produce a vaccine. And this has been done in months. Now, I've been following the vaccine and I think the numbers look great. And I'm hoping that it remains promising. But there's a lot of us keeping a close eye on this vaccine to make sure that it's not only appropriate for African Americans, but just appropriate in general for all of us.
So how do you strike that balance as a doctor and as a Black man who can look at the science behind this and say, like you just did, that you have a lot of hope in this vaccine? What are you telling members of the community, the Black and brown community, who are skeptical?
Yeah, we have to stand close guard. We have to have those in position of power who resembles and look like the community on the front lines expecting the vaccine to make sure that it's appropriate. I'm looking at the numbers now. 40,000 people have been given the vaccine by Moderna and Pfizer. So I'm trying to see the numbers. As those numbers grow with more people being exposed to the vaccine, then it does bring a sense of calm. But if you even look at something as simple as the flu shot, which we all should get, by the way, only 40% of African Americans take the flu shot. And the flu shot has saved lives, you know, but with this vaccine, going back to the vaccine itself for coronavirus, the efficacy, at least that's being reported right now, shows a high number of 95 to 94% effectivity, which is pretty amazing given everything.
Yeah, but at the same time, too, don't you have to strike the balance as well, saying if enough people within our community don't get this vaccine, then how will we know how effective it is within the Black and brown community as they continue to improve these vaccines?
Right, and I agree with that. So I think with that in hand, what we need is appropriate strategies. So we need to sit at the table. We need to come up to make sure that we're communicating with the African American community, with my community, so that we can have a sense of understanding and that we could build the trust. It's all about building the trust back with this. The drug companies are, at this point, no one is out, I think, to sort of promote a medication or a vaccine that's not going to be effective. It's not in anyone's best interest, but at the same time, what's broken here is the trust within the system. The disparities and healthcare inequalities and equities, all that has to be fixed. And that all starts with just sort of addressing the sort of elephant in the room, which has been the historical factors that have taken place throughout our time.
Absolutely. And that's why voices like yours, Dr. Davis, are so very important. So thank you for joining us today. We do appreciate it.